Hi, I'm Dr. Adam Fields. Welcome to a video where you're going to be doing a lot of pressure and breathing to help relieve some TMJ pain. So we're going to go first to your zygomatic arch. We're going to go in the back of it, right to the top of it, right in here. You're going to get your knuckles in there. It's called GB3 in acupuncture. So we're going to push in on that, find that tender spot. If you don't feel it, come a little bit closer to your ears, and let's just breathe and feel. Just take a deep breath in through your nose. You're probably feeling some exquisite pain right now, and you're just going to breathe a little bit and let that relax. You've got your knuckles right on both sides. Pull the shoulders down a little bit towards your butt and let it relax. Good. Keep breathing. Let that sigh. Let your body relax. Relax your scalp. This one can help some tinnitus also. It can help some fullness in the ears. I've used this for eustachian tube dysfunction videos. It's wonderful for you. Okay, now you're probably feeling it calm down a little bit. You're greeting the pain and going a little bit into it, but not busting the door down. You're just going for the pain a bit. Now we're going to go work that temporalis muscle and just like this. Just do some nice circles. Get the heel of your hand right in on that temporalis. Oh, the temporalis is so good. That you can have trigger points in the temporalis that literally radiate to your teeth, and people can interpret that trigger point as tooth pain. So working the temporalis can have some satellite consequences in a good way. Okay, just let that relax. You know, there's a proverb that says, "A merry heart does good like a medicine, but a poor spirit dries the bones." So let's take that merry heart and use it like a medicine, right? Think about it. Thoughts are things. Thoughts are chemical events, reactions, muscle tension, blood pressure. So we want to control our thoughts, even though we're going through a challenge right now. Okay, we're going to do a little chin tuck with an open, where we're going to be doing some open mouth exercises. So first, get that chin tuck, put your palms facing forward, tuck that chin, and bring those ears back over the shoulders. And now we're going to add something. This will make it so that we can't open the jaw all the way, but we're going to put the tongue on the lower teeth and curl it forward. And open and close. Hold that chin tuck. Okay, now we're going to open that mouth, and we're going to go to something called SI19. We're going to go to the Tragus right here, and then just in front of it, when you open your mouth, there'll be a depression in there behind the condyloid process. And we're going to go with the fingertips and push right in there. You'll feel this radiate maybe into your jaw, and just hold and breathe. Let it relax. Should be starting to wane. Okay, we're going to just do some lateral flexion of your neck. Get a nice smile on your face. Let's keep that merry heart, that merry countenance, that merry posture. Mary Poppins. Just getting merry, getting happy. Okay, the next one we're going to do is called TE21, and it is above what we just did. So it's above the tragus, but also right at the border of the ear. And this time we're going to use the fingers. So go, here's the tragus, go forward, and then up from there, right in there. And again, you're going to feel some pain. You may want to use your knuckle on this one. It's a little easier on the fingers. And then just let it go. That's it. This one can also mimic a toothache in the upper jaw and can relieve that type of a headache, toothache. So let that head relax. Let that jaw relax. Just go, just melt. Just get a nice melted version of you. Happily melting. And let that go. And add the breath, stimulating your parasympathetic nervous system, getting rid of that fight or flight, going into that rest and digest. Oh, probably feeling that just crawl up at the sides of your head a little bit. And now it'll start to just let up. You might feel that your finger go in a little bit deeper and that relax a bit. Okay, let's go ahead and passively open your jaw. So put the web of your hand right here. We're just going to open it up a little bit and pull down on the jaw as you lift your head up. If this hurts in any way, stop, please. Do this at your own risk. Good, now we're going to go to GB2, which is below that tragus point SI19. So go ahead and just go below there, and you're going to, again, open your jaw or not. If you feel it without opening your jaw, no problem. I'm feeling it right here, and again, exquisite pain. We love it. It's scrumtrilescent. It just, you've got to kind of embrace that pain. It's sort of an inoculation to pain. You feel it, and yet you let your body relax and let your face relax. If you're tense, I gotta get it. It's not your answer. It's not your way forward. With the jaw, it's letting go, right? Just a few deep breaths. You might even feel these right around your eye sockets, going up into the sides of the head, letting it go. Good, let's just do a little 45-degree stretch. We're going to stretch this way and just, the neck, stretching your neck can really increase blood flow. I mean, your neck is obviously the connection between your brain and your body. It's quite important. We want to keep it loose. You can help proprioception. Proprioception is really positioning sense, and your TMJ has a lot of proprioceptors that are in communication with what's happening in the neck, especially in that suboccipital area. Let's go ahead to the other side, a little 45-degree stretch. You can help balance by stretching your neck. It's a winner. So now we're going to go right, it's called ST6, right? We're going to go to the angle of your jaw right there, and then we're going to go one finger up, and then we're going to go one finger forward. And again, knuckles on this one. And go right into there and just find your peace in this. Taking a moment for you right now. Taking a moment in the midst of all the craziness and just giving yourself a little love, a little self-care. Self-care is high-quality, hands-on healthcare, and you are doing it. This is healthcare. This is taking control of the situation and letting go at the same time. There we go. And just go ahead and let go. Wiggle your jaw a little bit. Okay, now we're going to go to ST7. We're going to go open the jaw, and we're going to go just in front of that condyloid process. So you feel the top of the TMJ right there. We're going to go just in front of it, right there. And with those fingertips, and this time we're just going to just push in and open the mouth ever so slightly and slowly. Feels good. You're going to feel like a breath of fresh air in your TMJ after we're done. I have a lot of TMJ videos depending on what you need, right? TMJ 5 is focused more on posture. TMJ 3, we get in the mouth and we do some muscle work. Find the one that works for you. Do a couple of videos per day. If you have some degeneration in that TMJ joint, get some shockwave therapy, extracorporeal shockwave therapy. I recommend that highly. I do cranial adjusting to help the cranial bones so that the jaw fits better into the temporal bones. And just open and close. Good. We're going to go ahead and take your tongue and just do it as I speak it right now. Take the tip of that tongue and run it back on the top of the mouth all the way to the soft palate, all the way to where it gets soft. And now hold it for 5, 4, 3, 2, 1. And now bring it back and push it straight out towards me, sticking your tongue out at me for 5, 4, 3, 2, 1. Now let's bring it back, back. The tip of the tongue all the way to the soft palate. 3, 2, 1, and then all the way forward. In Tibet, and push it out. In Tibet, it's a greeting when you stick your tongue out. You're showing people that your tongue is pink. It isn't like a black tongue from this evil ruler, and you weren't a reincarnation of that particular ruler. Now bring it back all the way to the tip, all the way to the tip of the tongue, all the way to the soft palate. Good. Hold it there for 5, 4, 3, 2, 1. Wouldn't it be fun to greet people in Tibet with your tongue open and your tongue pushed out at someone? Okay, push it out for 5, 4, 3, 2, 1. Okay, now what we're going to do is we're going to open your mouth, and we're going to do an open mouth exercise with the tongue curled forward, just like this. And we're going to laterally flex the head. Okay, now we have a word of the day. I want you to put the tip of your tongue to the roof of your mouth. I want you to close your eyes, and I want you to start breathing in and out through your nose. The word is forgiveness. I want you to breathe in, and breathe out, and say the word to yourself, forgive. And let's do it again. Big breath in. You got to forgive in order for that jaw to relax, and breathe out and forgive. So we're going to forgive anyone, because in your subconscious, if that's running around, when you sleep, when you're fidgeting, whatever it is, that jaw will get tight. So we're going to breathe in, and I want you to forgive yourself right now. Go for it. Just clean the slate. it's over. Whatever it is, whoever it is, whatever it is. Go ahead and big breath in and breathe out and forgive that person. If they could be alive or dead, just let it go. Let it go right now. Pay the debt. Forgiveness is literally a banking term. It's forgiving by paying the debt. I got this one. Don't worry about it. It's like it never happened. Let it go. And that's going, and you can open your eyes, and that will go into your sleep. That will go into your subconscious, into your dreams, and that jaw will let go more. Do a couple of my videos a day. Thanks for being here. I appreciate you and your journey.